Hello, my name is Christine Vane A. Bakiran, a student nurse from Our Lady of Fatima University, and today I'm going to assess a male genitalian. So first I'm going to inspect the penis. First I'm going to inspect the base of the penis. Also check the pubic hair for growth pattern or excoriation, the erythema, and also find the sign of infestation. So while doing this inspection into an actual patient, the client must be standing while you sit. So also inspecting the shaft for lesions, redness, or rashes, lumps like that. Now to palpate the shaft for hardened areas or areas of tenderness, checking for the tenderness. Then now inspect the foreskin for color, location, and integrity. Now inspect the glands for the size, the shape or lesions or redness, and location of the urinary meatus on the glands. And if ever the client is uncircumcised, ask him to retract his foreskin to allow for observation. Then also palpate for the urethral discharge by gently squeezing the glands between the index and the thumbs like this. Check for any discharge. That. Now for the scrotum, first inspect the penis for the size, the position, or the shape. Then observe for swelling, lumps, or bulge. And then inspect for the skin color, the integrity, in the presence of lesions or rashes. Then palpate the scrotal contents and the testis, epidermis, using your thumb and the two fingers like this. Okay, notes for the size, the shape, the consistency, in the presence of tenderness or nodules, and also palpate cheeks, spermatic cord, and vas deferens, noting nodules and swelling or tenderness. Then, since I'm not assessing an actual patient, I'm going to skip the inguinal area. Now for the anus and perineal area, since we don't have an actual patient or any mannequin, I'm just going to explain how to assess the anus and the perineal. So first, the anus, inspect for the size, the shape, the location, the distribution, configuration, and also inspect for lumps, ulcer, or rashes, redness, or ulcers like that. Then inspect for rectal prolapse with Valsalva maneuver. Then palpate for the anal sphincter tone and for tenderness, nodules, or hardens. By palpating the anus or the anal, we're going to use the index finger and the middle finger, and the location is by palpating is the right, left, up, and down. Then for the rectum and prostate, palpate rectal mucosa for tenderness, undergiltis nodules, and hardness, and also palpate the peritoneal cavity for tenderness or nodules or rectal shelf, and also palpate the prostate gland for tenderness, size, shape, texture, or irregularities. Then inspect the feces for blood and perform occult blood test. So that's all for the assessment of male genitalian, the anus, the perineal, the rectum. That's all. Thank you for listening.